Good evening. It's Dr. Chris Lauria from Roanoke Knee Solutions, and we're creating this live event this evening. Again, I get a lot of questions and people that ask questions, and this seems to be the best way to get that information out. So not only that person can get their answer, but I'm sure if one person has the question, multiple people want to hear the question. So what we're going to handle tonight is, obviously knee pain is something that people deal with a lot, and we deal with people with degenerated knees, arthritic knees. We can help people even with small tears, help to get them relief with class 4 laser treatment. And the laser is the main part of the program, but we also do a lot of other things too to work on getting the best structure, motion, muscle balance in the lower extremity. We do trigger point work to help people with knee pain. In addition to the laser, sometimes we'll use orthotics to help the structure and the function of the whole leg as we're treating the knee and helping the knee get better. Because a lot of times there's a lot of compensation because you're limping, because you have so much pain, you put more weight on one side than another to compensate, and that creates problems with that side. So we're trying to treat the whole thing, not just the symptom of the pain. And again, we use class 4 laser treatment, which is the most powerful FDA cleared laser uh, that you can use. And what laser does, it sends laser waves into the tissue. It creates a response that can help to cut down on inflammation, irritation, swelling, pain. It can stimulate cells to regenerate or rejuvenate cell tissue and cell growth within the joint. So it's a direct treatment for the knee joint itself. There's a lot of ads out there now that are trying to compare something called stem wave, soft wave therapy, or acoustic wave therapy to something called cold laser therapy. And it's saying it's much quicker, it's much more effective, and those type of things. Well, cold laser is low level laser, so it's not at the same frequency and doesn't have the same effect as quickly as class 4 laser does. So class 4 laser is the most powerful and best response of all of them. So comparing cold laser therapy to class 4 laser treatment or stem cell acoustic wave treatment, isn't really a fair comparison at all because we don't use cold laser on our joint problems. We use class 4 laser. Cold laser can be very effective and it is the same response. It's just not as powerful. So you do have to keep it on much longer. It doesn't emit any heat at all. Class 4 laser can emit heat, so we need to do things to prevent that type of thing. So cold laser can be very effective, but it can't be compared to class 4. Stem wave therapy, acoustic wave therapy, soft wave therapy, that's sending sound waves into the tissue and in sense damaging tissue and causing a response to help the body send healing cells to that area, which can help with those type of things. We have an acoustic wave, we have one in our office. Find it pretty difficult to use over a joint because it can be painful to that area, so you have to be treating at a much lower level, which you have to do more treatment with that or a different frequency to help. So again, I just wanted to clear that up for people so you have an understanding of that. We utilize all of those in our office. There's not one thing because sometimes the soft wave or acoustic wave can help people treatment with the laser go a little bit more effectively. But we found in using all these therapies that class 4 laser has the greatest response. It's the most specific, the way we utilize it, and we can treat people much quicker in the long run and have a longer lasting effect. The laser treatment, the studies that are done with laser show that it does have a long lasting effect if the patient is a candidate, and if the laser they do have a positive response to the laser treatment. So anyway, I just wanted to explain that to you. If you're interested, you're dealing with knee pain, shoulder pain, any kind of joint pain, class 4 laser can be used in all these areas. It's safe, it's effective, it's FDA cleared, just like all the other ones are. But in doing this for the number of years that I've done, I found that that's been the most effective in treating knee pain or joint pain. So if you're interested in reaching out to us, you're dealing with that, and one of those other treatment protocols that's not being effective, we do offer a complimentary consultation. As you see, that's going across the screen. Just call that number, and we'll set you up for the first consultation. Talk about the symptoms you're dealing with, review your X-rays, MRIs to determine that you are a candidate for this type of program and it is going to work. And then we'll design a program for you if you are a candidate. And again, we're not just treating the symptoms with the laser, but we're doing other things to work on the structure, the function of the joints, so the effects of the laser treatment will last longer. Okay, it's Dr. Chris Lauria from Roanoke Knee Solutions, and it's great to be on again. And we'll talk to you next week with our next live event. Have a good evening. Bye bye.